Ladies and gentlemen, it's a great pleasure to myself today to be presenting my presentation in this esteemed meeting, among this esteemed gathering. My name is Sherif Essam. I'm Professor of Vascular Surgery at Essam University, and the title of my presentation is The Vascular Surgery Crisis in Africa. And throughout this presentation, and in brief, in very few minutes, less than 10 minutes, I'm going to go quickly through the main problems, healthcare problems related to the vascular surgery that we share in common among our African countries. The first problem, as we all know, is the stroke, and the stroke results from impairment of the blood supply to the central nervous system, mainly the brain. And we all know the stroke and its deleterious effect on the individual, becoming incapacitated and unable to work, or even in some instances unable to serve himself. And this constitutes a very impactful healthcare problem. The second, a very common problem in the vascular surgery discipline is the peripheral arterial disease, affecting the blood vessels of the periphery, which namely the upper limbs and lower limbs, and in particular the lower limbs. And this is very common image to see, which is gangrene of the toes or the foot, or even gangrene in the limbs of so many individuals because of the blockage of the peripheral blood vessels affecting or supplying blood to the legs, resulting in what is called gangrene. And in some of those patients might lose parts or even whole limb. And of course, this will lead into a very dramatic healthcare situation in which the individual cannot properly work or even again serve himself. There is another problem, which is the aortic aneurysms. As we all know, that the aorta is the main blood vessel coming out of the heart and supplying blood vessels to all our body organs. And the aortic aneurysm is very common, but unfortunately it's an underestimated problem among most of the African nations, because the aortic aneurysms is one of those problems that needs screening for early detection. Most of the patients affected with aortic aneurysms unfortunately present late when the aneurysm ruptures, and so many cases of sudden death were contributed by aortic aneurysm rupture, which was not diagnosed or under-diagnosed. The fourth problem is the blood clotting in the veins, or the chronic venous insufficiency, or deep vein thrombosis leading to chronic venous insufficiency. And as we all know, that these problems largely affect so many women in the childbearing period, either deep vein thrombosis with the pregnancy or deep vein thrombosis after childbirth. This is something very common among so many females. And as we see in this image, that in some cases of such chronic venous insufficiency patients, they might suffer from chronic debilitating venous ulcers over the leg for so many years after their affection with the deep vein thrombosis. And again, this is a very deleterious, has its very deleterious effects on the healthcare outcome of each individual and the community. So in short, we're going to classify the problem into several factors leading to the problem. So the factors, we have classified the factors into patient-related modifiable risk factors. This include the smoking, the unhealthy diet, and the physical inactivity. There are another factors which we call patient-related non-modifiable risk factors, like the age, ethnicity, and genetics. There are other factors related to the healthcare system, as we know that many people in Africa lack access to quality healthcare, and this including even the preventive or the primary medical care. And they lack also access to the early detection of so many diseases, and the vascular disease are among such diseases. The other factor is the socio-economic factor, and as we all know that the poverty and low levels of education and the lack of awareness both among the vascular healthcare professionals and the public might impose a high burden of such vascular disease over the individuals and the community. So we have also, this is a breakdown of the challenges and the solutions for such challenges. The challenges, so the first challenge is the limited access to the healthcare and diagnostic facilities, and the proposed solution is to invest in the healthcare infrastructure, and this includes the diagnostic and surgical facilities. The second item in these challenges is the lack of awareness, both among the healthcare providers and the general public. So the proposed solutions for such challenge is the training healthcare professionals on one hand, and on the other hand, improving the screening programs for the public and raising the public awareness about such problems in order to have an early prevention as much as possible. So by the end of my presentation, I have to call for action. A call for action for what's called the African Health Task Force mission. The mission of such a task force will be divided into these four lines or four pathways. The first pathway is avoiding the problem. The second pathway is the early detection of the problem when it happens. The third problem is the proper management of the problem. And the fourth pathway is the sustainability and the development of the healthcare system. Regarding avoiding the problem, this will happen through promoting healthy lifestyles, including raising the awareness about the importance of healthy eating, regular exercise, and avoiding smoking and alcohol consumption. The second pathway, which is the early detection of the problem, and this will happen through improving access to the healthcare by expanding the access to the preventive and primary care and early detection and treatment of the vascular disease. The third pathway for the task force mission is the proper management of the problem by strengthening the healthcare system, and this includes training the healthcare workers and improving the infrastructure and developing proper policies and programs to address the vascular disease and their solutions. The fourth and last pathway in the task force mission is the sustainability and the development. And this will happen through conducting research which is needed to better understand the epidemiology and risk factors and outcomes of vascular diseases in Africa. So in conclusion, ladies and gentlemen, by addressing these challenges and the thoughtful hard work to find the proper solutions for such challenges, through this we can reduce the burden of vascular disease and improve the health and well-being of people in Africa and in our nations. And thank you so much for your attention.